Good afternoon. My name is Jason Miller. I'm superintendent of Lee County Schools, and I want to thank you for joining us for our virtual town hall meeting today. Over the years, we've asked parents and community members to give us their feedback and input on many issues such as developing a strategic plan or school safety, and we want that to be the case as we move towards reopening Lee County schools during the COVID-19 pandemic. Today, we're going to talk about that and in particular discuss the protocols that we have in place and the plans that as we look to start a new school year on August 7th. So, thank you for being here. Thank you for the dozens and dozens of questions we've gotten and we're still getting. And hopefully we can answer some of your questions today and we can walk through this together and make sure that we provide the best possible education for our students in the safest possible environment. Safety is our first priority as we come back to school in the new school year. It is always something that is before our leaders and our teachers and staff, that we want to make sure our students are safe. Learning cannot occur unless there's a safe environment for our kids, unless they can be comfortable where they are and what's going on. Like most schools in the state of Georgia, Lee County is providing families with an option for in-person learning at school in a traditional approach or virtual learning at home. And that's what we're going to talk about today. The power of choice, I think, is great for our parents to make a decision that is best for their family and their personal situation or their students. And we want to help you walk through that time of making this choice and make sure that you have as much information as possible. We know that parents are going to consider protocols that are in place and make a decision in light of some of those plans that we have for Lee County schools. Our plans have evolved and are developing even as we speak today. We've consulted with state, national, and local leaders, and we've talked to the Department of Health, and we've talked to many school systems across not only Georgia, but in other states like New Jersey and Colorado and Louisiana, and we are moving forward based on the feedback we've gotten and the research we've done. Primarily, our plans are going to be guided by a document called the Georgia Path to Recovery for K-12 Schools. This document was developed by the Georgia Department of Education in conjunction with the Georgia Department of Public Health. It was released in June, and it's got 10 pages of guidance or suggestions for how schools can reopen safely. The state guidance begins by addressing community spread. The slide here presents 3 scenarios with different colors. The communities that have substantial spread will go back to school with virtual learning based on this guidance. Communities with minimal or moderate spread have 3 options to return to school: traditional, hybrid, or virtual. Lee County is going to give parents a choice between the traditional and virtual options. This does not mean that hybrid has not been considered or will not be considered if circumstances make it necessary. But right now, our best thinking is that we are going to have traditional in-person learning or virtual learning based on the parent choice. And then of course there are communities that have had no spread of COVID-19. Currently, based on the Georgia Department of Public Health's latest data, Lee County has minimal or moderate spread. Parents, if you want to look this up, there's a map on the Georgia Department of Public Health website that you can go to and look at each county and see their data and see where we are in light of our community. Our plans moving forward will be to present these options, and we're going to answer some questions about these options. Now, y'all, I'm going to just talk to you, and I'm just going to tell you what our answers are to some of the questions that we've received from you. Thank you for your questions. Your input has helped shape and develop our thinking and our plans. Please continue to communicate with us and provide us your feedback as we move forward. We will address each question in this set. The questions do not cover all the questions we've received. These are questions that are very common, that have been repeated by many people, and we will try and answer each one individually. Please remember that as we answer these questions, what we say today may not be the same as we approach the beginning of the school year or even after the school year starts. We're going to talk about social distancing, face coverings, buses, cleaning, virtual learning, and student health protocols, among other things. Again, I want to thank you for your input as we have heard you, and we're going to answer your questions to the best of our ability. The first question is, with the large capacity of students who attend the school system, how will we ensure that the 6-foot social distancing rules per CDC will be followed in classrooms? This is an excellent question. This is something that schools have struggled with, because schools, quite frankly, are not designed for social distancing. We're designed for large numbers and to accommodate hundreds of students. There are 6,500 students in Lee County schools. An example of social distancing in the classroom would require, with 6-foot distancing between students and the teacher, there could only be 10 students in a class with one teacher. Our average class has about 25 students when you look K-12. So as you can see, that puts a severe limitation on the number of students we can serve at a time if we observe social distance. Likewise with our buses, a typical bus can only transport about 1/3 of its usual number of students with social distancing. So we have to address this as we come back to school. And the way we'll do it is use something that the CDC describes as cohorting. And cohorting is limiting contact between student groups. For example, if I'm a student in 3rd grade, I'll stay with my teacher most of the day, and we'll limit the interaction between that class and other classes on the playground, at PE, in the cafeteria. And this way we can be sure that we are protecting our students. We plan to keep these classes together as much as possible. That'll look a little different in our upper grades. We're going to limit traffic in the hallways, we're going to limit the visitors to our buildings, and we're going to observe social distancing whenever possible. Probably the most feedback we've gotten from parents and community members is about face masks. Are our face masks mandatory or optional? Last week I had the opportunity to talk to a healthcare professional, and I was able to talk to him specifically about this. This is a physician, and this doctor said that there's 3 things we can do to mitigate the spread of COVID-19: social distancing, washing our hands, and wearing a face mask. We strongly encourage everyone to wear a mask. It is not mandatory at this time, but we reserve the right to make a change if necessary or as the situation develops. But wearing a mask is good practice, and we think it's safe, and we believe that it's going to help us protect our students and staff going forward. That being said, mask wearing is not mandatory at this time, but it is strongly encouraged. The next question is, will it be possible for students to obtain masks to wear during their interactions with other students? Yes, we will be providing a limited number of masks to students as we go through this new school year. Another question about masks is, what is allowed what restrictions on designs are there? There are no restrictions for face masks or face coverings other than that they cover the mouth and nose and are appropriate for for the school setting with regard to messaging or designs on the mask. I've got a few masks that we'll probably see coming into the new year. This is a surgical type mask. This will be very common. It's acceptable. Here's a mask that was produced by one of our local churches and donated to our schools to help us provide food in the feeding program this summer. This kind of mask is perfectly appropriate. This is a tie-on type mask made from an old t-shirt that one of our athletic programs is providing, is needed. And I think this is going to be very common in the new school year. This is a shield that a person can wear, and it will cover the mouth and nose. And I believe we're going to see all these types in our schools, and they are appropriate, as I said, as long as the imaging or designs on the mask are appropriate for a school setting. The next question is, what guidelines will be followed to ensure our students are safe on the buses? As we said earlier, social distancing on a bus would greatly limit the capacity of the bus or our ability to transport in a timely manner our students to school. Buses will be cleaned regularly with a particular focus on high-touch areas. The cleaning will work on the surface of the seats, the backs, where the kids place their hands, doors where they enter into the bus. There will be hand sanitizer available, and our drivers will be wearing personal protective equipment as they transport students daily. Another question that we've heard a lot is, how will classrooms and schools be cleaned? Enhanced cleaning will take place daily in all of our classes and all of our schools. We will focus on a frequent and deep cleaning of high-touch areas, just as we said with the buses. Things like desktops, door handles, black boards, or whiteboards, or other surfaces that the students will have contact with. And please know that the chemicals that we use are safe and they meet CDC guidelines for COVID-19. We've had several questions about virtual learning. Here's the first. If I choose the virtual option, would it be easy to transition to regular school when we feel comfortable? Or will the student have to do virtual school all year long? Families who choose virtual learning to begin the school year can transition back into in-person learning depending on their grade level at a certain time. For our K-8 students, that time will be at the end of the first grading period, or the first 9 weeks. On a calendar, that'll be about the first week of October. For our high school students, grades 9 through 12, the transition back to in-person learning from virtual learning will occur at the end of the first semester, which that'll be after the holidays beginning in January. Another question about virtual learning is, will we as parents have the opportunity to learn more and try to understand the requirements and plans for virtual learning before the opt-in date? Today, a virtual learning application was posted on our system website. Any parent who's interested in that option needs to complete that application. And in that application, there's some more details about what virtual learning is going to look like and how it will take place. So you can access that and look at it, fill it out if that's what you're going to choose for your child. We will also provide additional information through a town hall type format on virtual learning at a later date and before parents have to make a choice. Let me say this about virtual learning before we go forward. Virtual learning will not be like it was March, April, and May. We closed schools on May 12th of 2020. Schools were out the last 43 days of the school year. At that point in time, we were just entering into the time when we would have had state testing and we would have been winding down the school year. So we were in a very different position than we will be starting out a school year. I say this not to discourage anyone from this option. Each family has to make the choice that's best for them. However, it will be very different. It will be robust and rigorous. It will require a great commitment from the family to make sure that their child is ready and that they can stay in the virtual learning with success. And that's what we want for all our students, whether it's virtual or in person. And we're going to do everything in our power as a school system to make sure our students get the best possible education and that they grow and develop as a learner. Another question related to virtual learning is, this is a question about the extended day, and several people have emailed about this. Will extended day be offered during the 2021 school year? What protocols will be in place to keep our students safe in extended day? Extended day is an after-school program that parents pay for, and their students are able to stay after school for several hours until their parents get off of work. This program has been going on for a number of years, and we will provide this program this fall as we have in years past. There are protocols being developed, plans are being developed so that we can keep our students safe. You may have heard or read in the news that many day camps and summer camps have gone on this summer with a great deal of safety and protection for the people involved. I spoke with the superintendent just this week about a summer school in that area, and it was going very well, and their students were safe and were being successful. We believe that this will be likewise here in Lee County, and more details about that will be forthcoming. There's been a lot of questions about health issues, and rightfully so, and I want to address a few of these. Some of the questions are very specific to an individual or person. I'm not going to talk about that here today, but I do want to talk about what our healthcare protocols will be when the school year starts. The first question is, what are the plans for kids with health issues when school reopens? Our school nurses and leaders have worked very closely with healthcare officials to develop plans to make sure that we are able to take care of the needs of our students, just like we do in a typical school year. I think that the plans are going to be very welcoming to the students to make sure their needs are met, but also the parents are going to be comfortable with them. We had a specific discussion about a specific condition with our district health director just recently, and we were able to develop some protocols in light of that particular condition, which we see a lot in the schools. In a typical month in Lee County schools, over 5,000 students, or there's over 5,000 visits to the nurse's office when you look at our 8 schools and 2 programs. To give you an idea of the volume that our nurses are dealing with. And that's going to continue. You know, it's things like a scratch or a tummy ache or a runny nose or many other things, medication requirements or treatments that students might need. All those will continue with healthy and safe protocols. And we're going to make sure to meet the medical needs of our students as that they are properly addressed. One question that has come up a lot is, will there be temperature checks and sanitation stations open upon entering the schools and classrooms? Periodic health screenings will take place for students and employees. This includes temperature checks. There will be hand sanitizer readily available throughout the school for our students. Another health question, and this is one that's come up quite a bit, is what will happen if you have a positive case in the classroom or school? In the event that a student or staff member tests positive, we will follow health department protocols for contacting and following up with all students and staff who may be impacted. We will act in accordance with what is best for student safety. We actually went through this last spring as school was called off. We had a situation where an individual tested positive and was in contact with several other individuals in our school system. Our Southwest District Health Department and our local health department were fantastic in their support. Many phone calls, many discussions with nurses, doctors, even epidemiologists, working to resolve this situation, make sure that the people who needed to know knew, and they knew what to do in response to the situation. I cannot say enough about the support we've received from the health department and the district health leader, and I think that's going to be emblematic of what we'll see going forward. That's going to continue to be the case, and if there is a situation where someone tests positive, whether a student or a staff member, we are going to walk through that together, and we're going to make sure that the people who need to know will know, and that we'll be implementing safe protocols to protect our students and our staff. The next question is, if a student is sent home with a fever or other symptoms, will it be assumed that they have COVID? Very good question. As you probably know, recently the list of symptoms for COVID-19 has increased or been added to the number of symptoms, and many of them are common with a cold or an illness that we might see in our family or even at school. So how will our school nurses handle that when the student comes with, say, a runny nose or a sore throat? School nurses have a protocol that they will follow with students who show symptoms of illness. It's too detailed for me to go into here, but suffice it to say that it is both thorough and appropriate. It is well thought out, and it was developed, again, with the input of a lot of experts and a lot of people, and we're going to implement that. One thing that you'll see in the new school year is a student goes to the nurse's office. We'll have an isolation area for a student who may be sick. Not that we leave them alone or unsupervised, but just separate from, say, a student who needs to take medication or a nebulizer treatment or something like that, just a routine visit that occurs daily, or check their blood sugar. Those students will be separated to ensure their safety, everyone's safety, and there is a specific protocol depending on the scenario and the symptoms that the student may have. I think it is going to be something that our nurses handle very well. They are the front line and our point people when it comes to school safety and school health. Another question is, what criteria must exist in order for schools to close? Who would make the determination to close schools? Again, we'll consult with state and local health officials regarding the criteria for school closure. When our school was closed last spring, our schools, that was done with a lot of guidance and input from many people. It was not just a reaction or a snap decision. We will certainly do likewise in the event that there is a school closure or it's necessary. As the superintendent, I'm the person responsible for making that decision. But that decision, like any of the decisions we make, is not a decision made in a vacuum. It is a decision with a lot of consultation. We will do what's best for our students. I assure you we're going to try our best to keep them safe and ensure that they can be healthy and we cannot come to school and be unsafe. The last question we're going to talk about today is, if schools are forced to close and students have to do virtual learning, what happens to parents and families that do not have access to high-speed internet at home? This is a very good question. It's something that school leaders across the state and the nation have struggled with. There are areas where internet access is just not possible, in particular in rural areas. Just in the last week, I had a conversation with our state school superintendent specifically about this issue. It's something that he's passionate about, and he's developing plans at the state level. I know our governor is working to address this, and I know that there's a call nationally to address this. We're going to be able to assist families with devices as we did when school closed back in March. There are some low-cost internet options available through AT&T and Mediacom. Those are posted on our website under Back to School Updates. And then we're going to work with families to ensure that learning and student growth does not stop if there is a school closure. even if a family cannot get internet where they are, or there's no access where they are. We've considered many options to help improve in that area. There's going to be some things that we're going to do here in Lee County that I think will help us with that, but it may not be where we can reach every single family, especially those that live out in the rural areas. We're going to do our best, though, to ensure that their learning continues and their growth does not suffer. Before we close, I want to answer one more question, and this is a question I just got this afternoon from at least 2 people I know. Will there be a virtual pre-K option? And the answer to that question is yes. Pre-K is a state program operated by the Department of Early Care and Learning, and we of course have a robust pre-K program here in Lee County, and we're very proud of it. There will be a virtual option. Some guidance was sent down from the state today to our pre-K director, and plans are being developed now. Parents who have pre-K children will be reaching out to you to share that with you as it develops. So that's a very good question. As we close our time together, please keep in mind that the situation with COVID-19 is changing. The information we share today may not be applicable when school begins. We will adjust accordingly and develop plans to keep our students safe and our staff and our community. Safety is our first priority. More detailed plans about opening school will be shared next week on July 15th. If we did not answer your question today, please email us at the website, the email address reopenleeschools@lee.k12.ga.us, and we will respond to your question as soon as we can. I thank you for your patience and understanding. We are so blessed in this community to have outstanding support from our families. We take very seriously the responsibility we have to keep your child safe and provide them a great education. We look forward to working with you in the new school year, and we want you to let us know if we can help you. Thank you, and be safe.